Welcome back, everybody.
Dr. John Shufeldt is out at Good Sam Hospital today with Dr. Loffer, who is one of the top docs again, and it's good to see the doctors getting the attention they deserve, you know?
Absolutely. You can find out more about Dr. Loffer at aztopdoc.com. I thought for our last segment, Marty and Scott, we kind of look at where the future is going in interventional cardiology. So in a few years, when I come to them and with my chest pain, I'll know what to expect. So why don't we go over a few of these things that are kind of coming down the pike, and some of which are already here.
Okay, the first one is rotoblader that some of you may have heard of. This is a diamond-coated burr which spins at 150 to 200,000 RPMs, and it advances inside the coronary artery like this to drill plaque. And we use this mainly if the plaque is heavily calcified so that we can't dilate it with a balloon.
Wow.
And what we'll do is, here it's spinning, and we would slowly advance the burr. We have liquid here that really cools the coronary artery so that we don't overheat it and cause damage that way.
So this part spins here, and it chews up or liquefies, this is a better word, the plaque that's already there, which just floats downstream.
Absolutely. It's like a blender, and at high speed, a blender will liquefy pulp so that the debris downstream actually gets absorbed through the liver and the spleen.
Patient feels nothing, any risk of perforation, or is it pretty small?
Well, anytime we do anything, there's a risk,
Sure.
but the risk in experienced hands is very low. It's less than 1% of something serious happening.
Very good. Okay, what next?
Next, we have for stents that have re-narrowed, we used to just stretch them open with a balloon, but then the re-narrowing rate of those stents is very high. So now we have decided to use anti-cancer treatment. We know when we look under the microscope at these stents, at this re-narrowed segment, that it looks like a cancer with actively dividing cells. So what we can now do is advance radioactive beads and let them sit there for about 4 or 5 minutes. This is beta radiation, and what it does is it stops active cells from dividing, similar to anti-cancer treatment.
So oh, go ahead. So it's anti-inflammatory for the inside of the coronary artery.
Absolutely. And when we're done after about 4 or 5 minutes, what we'll do is we'll have the beads just get pulled back into the device here. This is obviously a heavily shielded device so that none of us get radiated with all this radioactivity, and this has been out for over a year now. And we were one of the investigative sites for a device similar to this.
Very good. Now, the other thing you mentioned was nowadays they have stents that are actually coated with blood thinning medication that really kind of prevent that clot from forming in the first place. What are those stents like?
That's right. We have 2 or 3 different stents that are out there that we are using experimentally, and we're the only site in Arizona that used the rapamycin coated stent. This is a chemotherapy drug, and as I mentioned, this material looks like a cancer. So we have these stents that are coated with an anti-cancer drug, which again stops these cells from dividing and from re-narrowing the coronary artery. In studies in Europe with this similar type of a stent, the re-narrowing rate at 9 months was 0, which is very, very impressive to us.
Boy, that's amazing. What was it before with the regular stents?
With a regular stent, the re-narrowing is somewhere around 15 or 20% at 6 months. If you make it past 6 months, you're home free. Very
good. You can find out more about Dr. Loffer at heartcenteraz.com on the World Wide Web. Thank you very much. It's been my absolute pleasure and education.
Thanks. Appreciate it. Thank you.
Yeah, and I want to remind you about aztopdoc.com. Thank you both. It's really been terrific today.
Thank you.
Thanks.
Thank you.
We'll see you soon.
Very good information.